All right, it is time for another edition of Ask a Doc, and we have our Mix Medical Center online where we have a fleet of doctors to help you out with whatever questions that you have. And it's a pleasure to have back with us today Dr. Benjamin Scott. He's our mixed dentist. How you doing, buddy?
Very good. How about you guys?
Doing
well.
Man.
Very good.
We got an email in, and this was a while back, and it was from a lady who has a little one. And her question was basically when is the correct age to start taking your kids to the dentist? My little one, the teeth aren't in yet, but I know that's going to be right around the corner. And she also mentioned that I'm sure different kids, their teeth come in at different times. Is there a set age that you need to bring your little ones and start going to the dentist? So that's the question for this week's Ask a Doc.
Well, excellent questions, and I get asked that all the time. Kids normally get their teeth usually around the age of 6 months is when they start getting their teeth, and they continue to erupt into the mouth to get 20 little baby teeth. Usually by the age of 3, they've gotten all of their teeth. The American Dental Association and the Academy of General Dentistry both recommend that children see their dentist for the first time before their first birthday.
Really?
Okay.
And I've noticed there is this new push, it seems, recently to have your kids seen by the dentist by one.
Yeah, maybe you guys have seen those advertisements on television.
Yeah.
That's what a lot of people have come in and talked to me about. I will tell you, in my practice, it's not terribly common for me to see 1-year-olds. You guys know I have 5 kids. None of my 1-year-olds would have been very good for coming into the chair, but the gist is, and what people are trying to emphasize is dental visits that are comfortable, dental visits that are easy. Get to know the person or the office first before someone's having a toothache and needing a problem.
That's a great idea.
And hopefully eliminate some of these phobias that we deal with in a lot of kids as they grow up and also into adults.
Sure.
That's actually a really good idea. Get the little ones familiar with the office, the dentist, the people there. They'll feel comfortable. And by the time they do have to have some work done, it's not such a traumatic thing.
Right. It's not a scary thing. So when a parent does bring in, say, like an 11-month-old for a visit, what can they typically expect out of that first visit?
Well, usually what we do is have the parents in there with them at all times. And the parent usually is holding the child. And the dentist, myself, if I were doing this, I would introduce myself to the child, and also the hygienist that was there. We would do that. We would try to do just a very easy exam, look at the kid's teeth, make sure it looks like dad and mom are cleaning the teeth right, maybe give some pointers, possibly look at, depending on the age, the development of the teeth, how they're coming in, the alignment, those sorts of things. Then give the parents some good information as they go home as far as maintaining, and decide when would be the next time to see their child.
That's a good introduction to the dentist and a good way to see if they're on the right track. And then the following, every 6 months from that point is a lot easier on everybody involved. And the end result, good teeth.
For sure. I mean, certainly, as we know, kids develop differently, and some kids, for instance, my third child, at 18 months, she got her teeth cleaned. That was the youngest that we'd ever had.
Wow.
Most of the time, it's around the age of 3 that kids are in there, and they've come with dad and mom a couple of times, and now they're ready to get their teeth cleaned. So it's all about being comfortable.
And all about asking questions about, what does this do? What is that for?
Yeah, exactly.
Can I press the water button?
Yeah.
Can I do this? Can I do that? Yeah.
I just pooped.
We like to have a couple of those real quick appointments where they want to know what all the buttons are. So that it's down to their cleaning time. We have time to do it for them.
Yeah, there you go. Well, that's excellent. And you have some tips, some Dr. Scott's tips. Do you want to run those by?
Yeah, I sure do. The gist is, even when the kids don't have teeth yet, it's important to clean their mouths. So it's encouraged after a couple of days of birth to start cleaning the kid's mouth with a washcloth and water. Then as the teeth come in, to get a baby toothbrush, start brushing the teeth, again with water. As they get a little bit older, they can start using the training toothpaste. A lot of times by about the age of 2, kids are able to spit the toothpaste out so they can start using fluoridated toothpaste. I always encourage parents, though, even when the kids are able to kind of brush their teeth for themselves, to keep helping the kids. It's been shown that children don't develop the manual dexterity to properly clean their teeth a lot of times until at least age 7. So that's a big thing. And then, especially in our practice, what we do to orient the kids is bring your kids with you when you come to the dentist. It's a huge thing for the kids to see dad and mom, brother and sister, whomever it is in the family, getting their teeth cleaned, seeing an experience that's not painful, that's kind of cool. Usually at that point, the kids will want to come back in.
That,
a good
I
idea.
think that's a really good point, because in the past, for me, I know from my personal experience, it's one of those situations where I would always say, well, honey, can you come home from work and watch the kids for a little bit so I can go do my dentist appointment? So you're saying, you know what, bring the kids so they can see you in an environment where it's not painful, it's not scary. And I think for an adult who may have some anxiety with the dentist, if you know your kid's there and you have to be the adult and not be scared,
Yeah.
that'll help you get over your fear of
It's
the
almost
dentist.
a win-win all the way
Not
around.
like I'm speaking from experience at all.
Yeah, exactly. But you know what? It's almost like tutoring them that the dentist is a safe and wonderful place to go, and it's a place you need to go to have healthy teeth.
Yeah.
And if you start out early, you're not going to have problems later.
Yeah, the hardest thing for me to do is, of course, kids' first visit is a toothache or
Yeah.
a real bad cavity. And
That's true.
then on,
That's their
it's
first
hard to get
experience.
over that
Yeah.
fear. So, that's why we encourage it so much.
That is
Very good.
excellent. Well, Dr. Benjamin Scott, I know you answered our emailer in a great way, and a lot of really good tips for people to think about as their young ones need to start going to the dentist. And some really good examples to take with them as well. Now, Dr. Benjamin Scott, they can find you. You're located right off Springfield, as well as in Village at the Crossing at Rod Sickler Salon and Spa, and they can get in touch with you as well through our website at mix945.com. We're going to have your email up there. If you have any questions, just tap on the email. It'll go right to Dr. Scott, and he'll answer your questions, and we might even talk about it right here on the segment. And you can ask anything dental, and we will definitely get right back to you, and you'll have that smile that you so deserve.
Thank you guys so much. My website, drbenscott.com, has a bunch of other useful information about kids going to the dentist or anything dental. If you look on the left-hand side, there's a button, an ADA button, and a Know Your Teeth button that will give you as much information as you possibly need.
That's
that's
excellent.
great.
You have a great website, by the
Yeah.
way.
Thank you.
It is easy to browse around through there, and it has a ton of information that's very helpful. So thanks for being a part of Ask a Doc, Dr. Benjamin Scott. We appreciate it, bud.
Thank you guys.